The United Nations Children's Fund, UNICEF, is raising the alarm over a surge in cases of severe acute malnutrition in Nigeria's northeast and northwest regions, a crisis it says affects over 5 million children. Now, UNICEF's representative in Nigeria, Cristian Munduate, disclosed this during a visit to Zamfara State in northwest Nigeria. News Central's Sagir Ibrahim reports from Zamfara, where he monitored the activities of the UNICEF delegation.
Cristian Munduate and her team began their visit at Gidandawa Bungudu Model Primary School, where she interacted with children and stakeholders. The team then proceeded to the Dr. Karima Primary Healthcare Center, where UNICEF is running an outpatient therapeutic program center.
Based on the severity of the case, they are managed based on that as outpatient. Those who have severe cases are referred to the stabilization center.
Another stop was the stabilization center at Yarima Bakura General Hospital. These field visits to project sites in Zamfara highlighted the severity of the situation.
If she doesn't want to see her future baby sick as well,
the revelations are alarming. In Zamfara State alone, 250,000 children, or 1 in 10, are suffering from severe acute malnutrition, with approximately 8 million babies born annually in Nigeria. Munduate warned that these figures could rise further.
We saw evidence and documentation that unfortunately some of them had died, couldn't make it. We want to highlight the urgent need to put a priority on children.
UNICEF's findings indicate that 50% of Nigeria's population, around 110 million people, are children. Of these, 40% under age 5 are stunted, while 1 in 4 children is out of school. However, Munduate noted some positive developments.
The number of children under 5 years for every 1,000 live births, it has declined. Another news is that Zamfara is keeping the status of 0 polio cases. I am a true believer that if you have the political will and determination, then things can change.
Parents, teachers, and healthcare workers underscore the urgent need for increased investment in child welfare.
Honestly,
I don't feel happy because when you have a child that is fine and is healthy, you'll be happy. But when the child is always sick and you always have to be in the hospital, it's very, very sad, and I hope the situation improves.
We need library, we need additional structures, we need gadgets for teachers, and more methodologies.
Flux of malnutrition now is high due to the economy. As a farmer, during the planting season, they take all of their plants or their seeds to the farm to plant. So mostly they don't have food at all. They now, as a farmer that used to have food, they now go to market and buy. So then they have to be prioritizing what to buy and what not to buy.
UNICEF estimates that addressing the needs of Nigeria's most vulnerable states, including Sokoto, Zamfara, and Katsina, will require over $250 million. More than $100 million is needed for these 3 states alone to fund essential programs for children in the region. In Gusau, the Zamfara State capital, Sagir Ibrahim for News Central.